You know, endodontics is going through a lot of changes. I've been in endodontics for over 45 years. And there's been a lot of change, of course, in the types of instruments we use and those sort of things. I mean, I used to be booked out, 3 months, which was terrible to be booked out that far. And now it's just tougher. And there are a lot of external and internal forces. I'd just like to talk a little bit about them. Some of the external forces are there are more corporate offices out there with their endodontists. Insurance are controlling, our fees. I mean, Washington Dental in our state has not given us a raise in 9 years and reduced our fees to 15% off right off the bat. There are more general dentists now that we have rotary instruments that are doing more endodontics. And sometimes if they don't work, they just take out the tooth instead of retreating and put an implant in. So more implants. Personally, I like implants because if there are teeth that are broken, I think it's a great way to go. There are more endodontists practicing, more graduating, and less endodontists are retiring, maybe because of financial issues and maybe because they've had just too many successful marriages. But the real competition out there are them going out shopping, cars, vacations, and things like that. That all competes with their money. We have no control really of those external forces, but we do have control of internal forces that cause us stress. For example, how do we manage having low production or our compensation each year goes down? Fewer patients, tougher cases, opening in our schedules, no-shows, last-minute cancellations, cases that we put in it for treatment and there's a vertical root fracture, or it's a long diagnostic issue and it really isn't an endodontic problem. And then, of course, I noticed with people, the endodontists I work with, there's increased drama in their practice. Student debt, regular debt. I mean, I've seen some young dentists have close to $2 million in debt once they buy their practice, their student loans, and all those other things. It's just overwhelming, especially some of the administrative challenges if you do not have systems in place. And what is amazing to me is that one major stressor is our vacation. You would think that's the best. But when you go on vacation, what happens is that you're always worrying about the other endodontist is going to take your patients, when this should be a real exciting time to be away. And that's why I highly recommend bringing an associate to work with you so you have these days covered and you can enjoy your vacation. Now, these external forces that I talked about, corporate offices, things like that, become irrelevant if you really learn how to master the internal forces and put everything in practice, the right systems, so you can control your practice and start having fun again. So we have no control of the external forces. We can control the internal forces. And I highly recommend you look at systems and ways to do that. Best of luck.